we were talking about what are high-risk pregnancies and what are the factors which would consider or make a pregnancy high risk. So what does one do when faced with these factors? First of all, what I feel is very important is to have preconception counseling. That is, talk to your doctor before you get pregnant. Why? Because there are certain medical conditions which need to be treated before you are pregnant. Like if you are diabetes, if you are diabetic, if you have high blood pressure, if you have epilepsy, you should be on the right medication which is safe for pregnancy before you get pregnant. Also, there are conditions like if you're having repeated miscarriages, you might require to start medication before you get pregnant. Because remember, by the time you're pregnant, you're already 5 to 6 weeks into, by the time you realize you're pregnant, you're already 5 to 6 weeks into pregnancy. So the medication has to be started right at the time when you're planning pregnancy, right? Now, preconception counseling is also important if you are an older mother and you might require certain invasive tests like an amniocentesis, which checks for the genetic typing of the baby, because some genetic defects are more common in the older mother. So talking to your doctor before you actually get pregnant is very important. Then of course, regular antenatal visits, like visiting your doctor as frequently as your doctor tells you to, and going to a good doctor in a good hospital with proper infrastructural facilities is very important, because from time to time you will be asked to do certain lab tests, certain ultrasounds, targeted ultrasounds to look for specific problems in the baby. Nowadays we have various tests which can diagnose problems in the unborn baby, structural and functional both. Then of course, following the advice of your doctor, having a healthy diet, changing medication. Remember, you cannot have all sorts of medications which you are having in a non-pregnant state. So having the proper medication, all these will cut down your chances of having a risky pregnancy. Then also we have certain tests the bigger hospitals can offer you. Knowing the condition, the functional condition of your baby, by ultrasound, but there are certain tests which get the heart rate tracing of the baby, which is called the CTG. So all these conditions will help you to keep you safe during your pregnancy. We all cherish our pregnancies and we are all looking forward to having this baby. So I think it's very important that you're aware of what are the factors which could threaten this lovely, cherished moment of your life and take adequate precautions to prevent it.